Hello, everyone. Welcome. Can you hear me okay?
Yes.
If you can't, good. Please let us know verbally or type in the chat box if you can't. My name's Kristen Eklund. I'm a midwife and a midwifery educator in Washington State, and I will hopefully be one of the people to help this call run smoothly despite our initial technical difficulties. I will start with some brief announcements, and that will also give latecomers a few more minutes to call or log in. To start off, I would like to express my sincerest apologies for overlooking the Jewish holiday of Yom Kippur scheduling this call. The call will be recorded, but choosing this date is unfair to anyone observing this holiday who would have liked to be present and have their voices heard. For those of you who were inadvertently excluded today, your perspectives will be missed. I am committed to avoiding making similar mistakes in the future and appreciate those of you willing to speak up to help me do better next time. For anyone unfamiliar with Yom Kippur, I thought I would take a moment to describe the holiday. Yom Kippur is the most solemn of the Jewish high holidays. It marks the end of 10 days of atonement that begin with Rosh Hashanah, the Jewish New Year. If there's time in the call, on the discussion part of the call, I'm happy to talk more about the moments at which I could have made different decisions regarding this particular issue, because there are some places I could have, kind of taken a pause point and made a difference regarding this, and I didn't do it as well as I could have, and so I'm happy to talk more about that later if anyone is interested. Certainly, as educators, we schedule things all the time. Several people have requested that these calls be recorded. If you would like to request the recording be turned off so that you feel comfortable talking, please let us know, and we are happy to turn off the recording. I organized today's Equity Strategy and Collaboration call for midwifery educators to provide us with an opportunity to collaborate and learn from one another as we seek to implement change. Thank you all so much for joining this conversation about implicit bias and midwifery education. We look forward to discussing how we can acknowledge implicit bias head on, and we hope that you will share challenges and successes from your programs. Here, before we get started, I wanted to encourage you to save the following dates. The next webinars in our series will be held on Wednesday, October 23rd and Thursday, December 13th. And we'll talk a little bit more about them at the end of the call as well. The first is Supporting Aspiring Midwives, that will be led by presenter Rhonda Lee Grantham from the Center for Indigenous Midwifery, and Stereotype Threat, which will, our presenters will be Cynthia Ballou and Byronia Matthews. And I haven't got to meet with her yet, so I hope I'm not pronouncing her name wrong. I'll have to learn that soon, if I did. And our next call in this series will actually be the first book club for midwifery educators. So it will be held at the same time of day on January 23rd. And we do want your insight on the book choice for this first book club. So we hope that you will take the brief survey that we have to weigh in on this particular issue. And that link should be coming up in the chat box, and it will also be sent out in an email following the call. I would also like to thank in advance Courtney Everson, who will be working with me to try to help everything run smoothly today. And finally, we welcome your feedback at the end of the call. There is space at the end of the book club survey to provide any input that you have or suggestions for future webinars or calls. This call is very much designed as a space where we hope you will ask questions and share ideas. When you aren't talking, though, we would ask that everyone please mute yourself for sound quality, especially if you are calling in on the phone. Don't be afraid to unmute yourself to contribute and ask questions during this call. It is designed to be interactive. You can also type questions or comments in the chat box inside of Zoom at any time, and our facilitators will be reading them and helping to bring you into the conversation. And now I would like to introduce our speaker, Lena Sue He Wood, who you can read her full bio here. She will share some information with us briefly, and then she will help lead us in an interactive discussion. Lena's journey to midwifery started with her experience as a full spectrum doula, and pregnancy options counselor. She has provided support for pregnant people in the context of birth, abortion, miscarriage, and adoption. Her areas of clinical interest include family planning care, reproductive mental health, mindfulness-based birth preparation, and LGBTQ health. She is also passionate about midwifery education, broadening the diversity of the midwifery profession, and working collaboratively to help place midwives at the forefront of addressing disparities in maternal health care in the U.S. She received both her undergraduate and graduate degrees in nursing from Oregon Health and Science University. And we are so grateful to have you here today, Lena. Even Lena couldn't get on the call until the last minute. So thanks for your patience with me.
You are so welcome. Can everybody hear me okay? If you can, just go ahead and mark a little yes in the chat box just so I can see. Okay, perfect. If at any point you can't hear, just let the facilitators know and we can figure out how to improve that. I am going to exit full screen here and do a share screen of my brief slides. And just give me one moment here. In the meantime, while I'm setting up, I would also love if folks could just type in the chat box what programs they're calling from, what or universities or programs that they're affiliated with, just so I can get a sense of who's with us today. Oops. Okay.
So great. Thank you all for being here. We're just taking a minute here to switch our share screens.
Oh, Kristen, do you know? Oh, here it is. Never mind. Desktop. Okay. All right. I think we should be good now. All right. Can everyone see my slides?
Looks good to me.
Okay, perfect. So Kristen, thank you so much for inviting me to help facilitate this conversation. A little more addition to my background, I guess, is that I am not currently a midwifery educator. I'm a relatively new midwife. I recently graduated from OHSU, and I'm currently in private practice. But as a midwife of color, this is something that has been really important to me, and it's definitely a passion of mine. And I see myself in the future very much wanting to work within you know, academic programs and help grow academic programs within midwifery. And I'm really interested in figuring out how we can continually improve our processes for better integrating things like implicit bias into midwifery education, with the ultimate goal of really expanding the diversity of our applicants to midwifery education programs and the midwifery workforce in general. I'm sure everyone here knows there's a huge need for more midwives in the US, and I actually see this component as a really important piece of that to help us grow our profession. So moving on. So implicit bias. This presentation is really kind of geared as an introduction. Some of you may have more experience than others. So if you have done a lot of work with this, bear with us. But really my goal is to give a little bit of background here, kind of draw some connections as to how this might apply to the context of midwifery education, and then really facilitate more of a conversation. So implicit bias, sometimes it's also called unconscious bias, and it's a very well-studied universal cognitive process in which basically our unconscious thoughts or associations, they can be positive or negative, impact other thoughts and actions that we take. And so some distinctions to make about implicit bias that differentiate it maybe from prejudice or discrimination. One is that the associations can be positive or negative. It could be something like we associate a certain group of people with having a really generally positively thought of trait, or it could be a more negative association. And I think that's what people tend to focus on when they hear the word bias, is the kind of the negative piece of it. But I want to encourage us to think about the positive implicit biases we might have as well, and how those still might impact our interactions with students and faculty. Other key distinctions here: implicit bias is involuntary. We all have it. It's not something that you can stop. It's an inherent part of being human. We're constantly categorizing and trying to make sense of the people and the world around us. But it's implicit in that we're not always aware of it. And many times our thoughts and actions that stem from the implicit biases that we hold may not actually align with our stated beliefs. And that can be really challenging for many people to grapple with. It's an ongoing process, as I'll talk about more. But I think that's what makes this kind of a scary topic for some people to talk about, because it requires us to be a little bit vulnerable in exploring our own personal, implicit biases, and those places where, deep-seated unconscious beliefs may be directing our actions in ways that we don't intend. There are numerous studies out there in healthcare research in the past several years showing how implicit bias impacts patient care and results in different clinical decision-making and poor outcomes, particularly for African-American patients. And I'm sorry I didn't have enough time to put more citations in here for that, but I'm sure this is not going to come as a new or surprising piece of information for you guys. But some of the studies that I came across include things like evaluation of pain between white patients and African-American patients, the percentage of time that cardiologists are willing to do more high-risk surgeries for patients just purely based on race alone, and implicit biases around how those patients might do and what their risks are.
Going to.
Oh.
Okay.
So, one of the things that I think is really great about implicit bias is that even though it is unconscious and often not something that we're aware of unless we're placing attention to it, is that it is measurable. And so some of you might be familiar with the Project Implicit research group. Was founded in 1998 by researchers at Harvard, and they developed the implicit association test, which you can actually go online and do. They have a lot of different variations of the test for different concepts. And so it's basically measuring relationship between specific concepts. It could be race, it could be age, it could be gender, it could be a particular type of condition. Like I know they have one surrounding mental illness. And then our evaluations of those concepts, good, bad, etc. And just looking for how strong of an association we have. And if anyone has ever done one of these tests, it's really kind of nerve-wracking because you're basically given this series of images and told to, as quickly as possible, sort through which ones you associate with each other. And it is very insightful. I actually did one myself, and I think what I learned from that, I wasn't surprised, but also it can feel overwhelming. As a woman of color, there was still a stronger association that I had for white people than for other people of color. And I think that speaks to an aspect of implicit bias, which is that everyone has implicit biases, even people of color, and we are all impacted by it. So I think that's something that we can come back to when we talk about how we discuss this in midwifery education. For those of you that want to get a little bit more information about the state of research in general, the Kirwan Institute out of Ohio State University has done a really great implicit bias review for the past several years, I think since 2013. And it's a pretty tidy little summary, usually like 40 to 50 pages or so, of the main new studies that have come out regarding implicit bias in a lot of different disciplines. So they do have a section on healthcare. They have a section on education in general, criminal justice, housing, police violence, things like that. And so it's a really nice way to get a window into how implicit bias impacts a lot of different arenas. But of course, our particular focus today is on education, and specifically midwifery education. So what is the midwifery context that we have? We know that over 90% of certified nurse midwives and certified midwives in the US are white. I apologize for any of our certified professional midwives that we have here. I don't have the statistics handy for that, but later when we're in discussion, if anyone does have some numbers they'd like to share, I'd be curious about that. And as well, percentage of student midwives or student nurse midwives. And as you can see, the majority of student nurse midwives enrolled in programs here in the United States are white as well, about 78%. That is changing. I had a chance to look briefly at the ACNM Midwifery Education Trends Report from 2013. So this is about 3 years old now. And hopefully they'll come out with a new one soon. But there's a lot of positive trends in the number of students of color who are applying and enrolling into midwifery programs and then graduating successfully. But we know that our current midwifery workforce is not really representative of the patients that we're caring for. And we know that there are major disparities in maternal health care that are leading to higher cases of worse outcomes, especially for our African American patients. And so this is something that I think is really important for our students to be very fluent with, and to be able to see both at the micro level and the macro level how implicit biases are impacting patient care and systems. So just as a sort of continuation of context here, I gathered a couple of statements from the various midwifery and obstetric organizations. We're starting to get on board with this and really understand that this is an impact. So many of our organizations now have statements professing to want to pay more attention to implicit bias and the way that it is impacting patient care. So this is from the National Association of Certified Professional Midwives. We have ACNM's very recent racism and racial bias statement that came out, I think, just last year. And, you know, it says right here, third bullet point, engage in lifelong introspection and self-development to identify and address midwives' own implicit bias, internalized racism, and potential to perpetuate racism. So that's, you know, coming from our, for those of us who are certified nurse midwives, that's coming from our professional organization, that we need to be assisting midwives from the very beginning of their training in engaging in this lifelong process. ACOG also has a really great statement on racial bias, addressing both the impact on patients as well as the need to better educate students. And I think one of the things I took away from this is that we don't have to reinvent the wheel. There are a lot of different healthcare professions that are working on this, and I think it would behoove us to really think of this as an interprofessional endeavor and learn from each other's successes and challenges. So I kind of identified 4 problems or challenges that we're facing as a midwifery workforce in general. I think there's the issue of how do we intentionally and meaningfully integrate the concepts of implicit bias and self-awareness and reflection into the midwifery curriculum, and not as a one-time events-based training or a one-time seminar or standalone course that's separate from everything else, but really as embedded in the midwifery curriculum, in, you know, how we present case studies and how we precept our students. I think there's also a strong need to review current practices around how we recruit students, how students find out about us, what are our assumptions about who's interested in midwifery, and then how we support those students through the recruitment, retention, and support into practice as graduates. There's definitely a need, and we've seen a few articles from this about this in the Journal of Midwifery and Women's Health around how to support midwifery faculty and preceptors in the ongoing self-reflection process. One of the great things I think about implicit bias is that we have all this data about how impactful it is, and we have data about interventions that can mitigate the impacts of implicit bias. So reminding ourselves that our brains are malleable and we can change, and that these are not things that we're kind of resigned to just living with. So in terms of supporting faculty and preceptors, I think there's a need for those faculty and preceptors to really model that process for their students and to be transparent about what the challenges are in that. And I think that helps to create a stronger sense of trust and community as well within midwifery programs, that then goes to support that concept of creating community and successful retention of diverse midwifery students. And then I think just in general, as a final big picture thing, that we should be consciously integrating awareness of implicit biases as we work to support the growth of our midwifery education programs, and ultimately the scope of midwifery practice in the US. There's a huge need for more maternal care providers, and I think that we really want to situate midwives to play a lead role in that, but we need to be educating midwives who are going to be sensitive to the many challenges of diverse populations that we're working with. And that starts with a good foundation of doing that in their training. So some strengths that I think we as midwives have in coming into this work, I think first and foremost, we're really comfortable, and we have our feet or our hands or our hearts in both the art and the science of our practice. And so I think that with implicit bias, there is the science and the data that we have, but this is also a really heart-to-heart conversation for many people. It brings up a lot of insecurities and old hurts and generational trauma for many students, particularly students of color. And so I think as midwives, we are already kind of familiar with how to hold space for those kinds of conversations. And I think in general, as we saw just from the previous slides and looking at the recent statements that have come out and new initiatives, that there is a renewed commitment across a broad spectrum of reproductive health organizations to address these issues of bias, discrimination, and disparities. Some of the challenges I see are just the history of midwifery, the racial history of midwifery, which is probably pretty familiar to many of you, but that continues to impact how we educate midwives in the US, what kinds of things are included in the curriculum or not. We talk a lot about the hidden curriculum. There's the overt things that we're teaching and lecturing and presenting about, but what are the hidden things that we aren't speaking, but that still speak to students about what is appropriate for midwifery care or not. I think there's definitely some just inertia and perhaps overwhelm should be added to that this is a big topic, and how do we do right in addressing it. Certainly fear, going back to that vulnerability piece. And then we already have so many things that we're needing to teach our students and make sure that they're addressing, core competencies in our curriculum. And so it can feel hard to find time to add one more thing in. But I would make the argument that this is not something that necessarily, we shouldn't think of it necessarily as taking more time. I think that if we integrate it in more thoroughly and thread these concepts through classes throughout, that it does not have to be seen as something taking time away from something else. So there was a great editorial a couple years ago in the Journal of Nursing Education. And she writes, I wonder to what extent our nursing curricula addresses unconscious bias and microaggressions as they pertain to caregiving, to the learning and work climates in our schools of nursing, and to the clinical practice environment. And I think that's kind of the question that I have for us as we're just starting to really delve into this more on a systematic level. You know, what are we doing in the midwifery curricula? And what are we expecting our students to graduate with? How do we measure that? So I would argue that I think it would be good for us to move away from the concept of cultural competency as an aspiration for our students. I don't think that that is comprehensive enough. And I think cultural competency to me implies that there's a certain type of static goal that you're achieving. And once you get there, you're competent, you're good. And what I really see, and I'm seeing and hearing some from programs as well, is that we're really trying to integrate these three different concepts throughout the curriculum. That's our students graduate with a key understanding of how personal privilege and institutional privilege and power impact midwifery care and outcomes. There's the structural competency piece, understanding the institutions of government, of healthcare, of civic life, and how that impacts healthcare. That's social determinants of health. And then again, going back to that personal piece of implicit bias, how is that impacting care? How does that impact the way we view our patients? And how do we set up lifelong processes for constantly being aware of those? This literally just came through my Facebook feed this morning. Ana Delgado, I don't know if she's on the call today or not. She's a midwife at UCSF, and she had posted this on her Facebook feed. It's an article from Forbes magazine, and I have the link here in the slides for you. And this was written by a CEO of a Silicon Valley company. And they had done an assessment, a climate assessment. And this quote here, only 57% of B-Lab staff who are people of color feel they can bring their whole selves to work, compared with 96% of their white coworkers. And I would really encourage us to ask how many of our current and aspiring midwifery students and faculty of color feel that they can bring their whole selves to work, and what role might implicit bias have in preventing that. So I do have some resources here at the end. This is really just the beginning of resources. And I would honestly start with Kristen's wonderful, wonderful website, Equity in Midwifery Education. She does have a curriculum section and includes a lot of resources on implicit bias, some systematic reviews, and articles and training modules and things like that. But what I really want to get into is the discussion piece. And so I thought of some initial questions to get us going. And I will turn to Kristen and to Courtney to help facilitate questions coming in. But I want to learn more. I want to talk more about what people are doing in their programs, what's been successful, what have been challenges. How are you choosing to measure proficiency in this topic? And what kind of conversations are you having around that? And then sort of big picture, what supports would be helpful in strengthening the integration of implicit bias? And part of that for me is how can we work as a community of midwifery educators to not reinvent the wheel? How can we be sharing ideas with each other so that we don't have to do this work in silos? So I think I'll pause there and open it up for conversation.
Thank you so much, Lena. Wow, really
welcome.
great. Yeah. I am just going to kind of remind everyone that this call is very much designed as a space where we hope you will ask and share ideas. When you aren't talking, though, we ask that you would please mute yourself for sound quality. You can unmute yourself to participate, or you can also type questions or comments in the chat box inside of Zoom, or via poll everywhere at any time. Not sure who our rogue unmuter is there. But that's a perfect example of why it would be great if you can mute yourself when you're, if you're not participating explicitly at that moment. And we're also happy to read things from the chat box if that's helpful. So what I will do is I'm going to unmute the callers, but that does mean you'll have to mute yourself from your own phone please. So there we go. Let me open it up perhaps with any of the questions, the first questions that Lena proposed.
While we give everyone a chance to talk about this, this is Courtney. Hi, Lena. I just wanted to answer your question around demographics for CPMs, as we know that you didn't have that data.
Thank you.
Yeah, to the best of my knowledge, I would be citing our article by my colleagues and I on practitioner and practice characteristics of CPMs, where we engaged in a survey a few years back now and published in 2015 in the Journal of Midwifery and Women's Health with CPMs through the North American Registry of Midwives. And at that time, we reported in that publication a response rate of 21% of respondents self-identified as people of color and 79% self-reported as white.
Courtney, are you still there?
I am, yes. That was the end of my thing. I was just giving you numbers.
Okay, yeah, sorry. Can you hear me still?
Yes, we can hear you.
Okay, cool. I was just going to clarify that that was for practicing CPMs, not for students.
Not for students, no. Our data on the students are harder to get in the CPM profession because we have both the PEP routes and the MEEC routes.
Right.
And so, and if the institutions are MEEC accredited and they are Title IV, then they do participate in IPEDS as the post-secondary education system. So that's one place we can pull some portion of that data, but it's not going to be consistent due to the varying routes and, of course, the different ways in which schools may be collecting this data as well, which I would argue is another issue to be considering as we start to employ approaches like targeted universalism that relies on having robust data and consistent data that we're able to compare both within and across institutions to see how we can work together in seeing where the inequities are, where the gaps are, how the implicit biases are showing up.
Great, thank you. So I am not able to see any questions that come in with the chat while I still have the share screen option going, and I do want to keep this slide up just to help prompt people with comments or suggestions or questions. So if you guys can just help, feed those into me as the questions come, that would be great.
You got it.
Does anyone want to try with the first question? Anything that you're currently doing in your programs to introduce and or integrate the concept of implicit bias into the curriculum? Or things you're thinking about doing or wondering where it might fit? I can say what we do at Best Year. We have our Power and Privilege course that the students take in their first quarter of their first year. And in that Power and Privilege course, at least 1 week focuses, the way I remember it, I've taken the course twice myself as a faculty and as a student in their maternal child health systems program. And I seem to remember it being 1 week where we focus on the topic of implicit bias. We take the test. I agree with your assessment, Lena, that I was scared and upset by my results, even though I also wasn't that surprised. But I think it's important to do because it's just a reminder.
Yeah, I would say humbling was the word that I used to describe kind of how I sat with that information after I got it.
Yeah, thank you. Not to say we had the same experience at all, but I hope that I had that reaction as well. Yeah. So we have someone in the chat. Oh, go ahead.
I was just going to ask, so what kinds of things are the students doing in that that week of the course when they're discussing implicit bias?
Yeah, I seem to remember definitely readings on the topic of implicit bias to learn what it is, being encouraged to take that, one of the tests that sort of shows you some of what your implicit biases probably are. And I think every week is a journal that you write and submit to the instructor and get feedback about your learning around the topic. I would say that's what I remember.
Okay. And do you have any recollection of what the conversations were like in class, both in terms of content, but also just how they were facilitated and what the feelings in the room were?
It's a great question. It's a hybrid program, so not every topic gets discussed in a live session or in an in-person setup. So that's a great question. And I know that Wendy Gordon just revised the course yet one more time because we have a majority of students of color in this year's cohort, and it was high time that we thought more about a course for all of our students and not as much just directed to our majority white students.
Yeah, congratulations on that, by the way. That's an amazing feat to have a majority students of color in your midwifery program.
This is Courtney. I will just continue on. You pose a really good question, Lena, of you know, what are the reactions to the students taking that particular set of IATs, and what is the discussion like? And I use them in one of the classes I teach on equity and anti-oppression, difference, power, and discrimination. And usually that particular class discussion and the reflection paper they do associated with it, for many of the students that identify as white, they come at it with a level of disbelief. Like the most common attitude I can tell you would be to say, obviously, this science is wrong, right? Obviously, this isn't right. This isn't reflecting me. And one of the things we have to dig deep on is this idea that your outward sense of self and your implicit, right, understandings, that's why we call it implicit bias, might not align. And how do we start to think through that? And that's the value, right, of the IATs. And so then I'll give them additional resources as well, such as ones on hidden brain and some podcasts, so that we're also finding multiple ways for the students to interact with different materials as well, because some of them need to hear it, you know, in a dialogue format, in a discussion, in a book. But that's one of the most common reactions until we really dig deep, and we use that kind of denial as an opportunity to a launching point, I would say, to have the dialogue further.
Thank you, Courtney. That's really great. Yeah, I think it can be a really touchy subject to have. And I would argue that this is, you know, if at all possible, that this is, you know, certainly for an initial introduction to the topic, I feel that this would be an important one to do in person whenever possible, because I think they're, you know, it can be hard to capture all of those nuances in an online platform. But if there is anyone who's doing primarily online teaching of these topics, I would love to hear from you about your experiences and to share any wisdom that you've had in that process, what modifications you may have had to make to the way you introduce the concept of implicit bias through an online platform.
And just to make sure we bring into the chat box into the conversation, there is someone who said they're interested in hearing also about ways educators are supporting midwifery students of color in their clinical practicum as well.
Yes, this is a great question. I don't know that I really have an answer to that. I don't know that anyone's really done a ton of research into it, certainly anecdotally. As a recent midwifery student and now new grad, I hear stories just, you know, in my interactions with other folks. And I would say that it really kind of depends on the relationship with the preceptor and how strong their background is in, you know, concepts of implicit bias and power and privilege. I think that, you know, some midwives have a better grasp of these concepts and are more familiar than others. and may not feel as comfortable, honestly, really critically sort of analyzing how those implicit biases may impact patient care. I'm really excited because I'm actually precepting a GYN student for the first time this fall. And I've been thinking a lot about how I want to be intentional in facilitating that ongoing dialogue and helping my student to make explicit some of her implicit biases that she may be coming in with about the patient's understanding of her condition, her symptoms, where they're coming from, care plans, what are the implicit biases that we're making about what we think a best care plan might be, based on different characteristics of that person. And, really going back to addressing what our agendas are versus what someone else's agenda might be. And I think a context where this comes up, particularly in the clinical setting, is around long-acting reversible contraceptives, that as healthcare providers, we tend to really like the IUDs and the Nexplanons because they're so effective and they have so minimal side effects, and feeling like everyone should be in love with these because they're so great. But clearly, as we see in clinical practice, not all of our patients are excited about them. And I think particularly in communities of color, there's some hesitancy around that given racial history of forced sterilization. So it's things like that I think, we're not only needing to train students, but also make sure that our preceptors are getting opportunities to continually connect with programs and with opportunities to explore these concepts as well.
I had something to follow up on that. This is Robin. I'm from Birthwise, and I've been wanting to develop some kind of training or curriculum for preceptors that we don't really see in person. So we're a MEEC school. We're working with EPMs in small home birth practices all over the country. The majority of them are white. Many of them probably don't have the opportunities to do trainings on implicit bias, or that hasn't been their interest. So to me, when I'm trying to connect students of color for a clinical placement, I feel this responsibility and this weight of what am I putting them into if these preceptors haven't looked at their own implicit bias. So if anybody at any of these other schools has already developed some kind of training for preceptors, I'd love to talk about that maybe in some other forum.
Robin, thank you so much for sharing. I think you're absolutely right. And I really appreciate the emphasis on thinking carefully about what settings you're sending your students of color into, what those preceptors' backgrounds might be, what the institutional setting might be like, for in the nurse midwifery context, what kind of hospital we're sending folks into. I think that's a really important thing. And students might not always feel comfortable bringing it up. There's so many other challenges that we're going through in school anyway. We know how challenging it is to even find preceptors and get clinical spots. So it often feels uncomfortable to then bring up issues of implicit bias that might come up, or if there are things that are happening that a student is observing with the preceptor that they don't feel comfortable with the way their preceptor is giving care because of the preceptor's implicit bias. So I think it's kind of twofold. It's supporting preceptors and maybe requiring a very basic training on implicit bias that's aligned with the values of the institution or the program before they're allowed to precept. And then also equipping students with tools about how to navigate those difficult conversations potentially, or how to advocate for themselves and advocate for a self-reflection process. Okay. I would love to hear from anyone who is not doing anything right now, or doing kind of what they feel is a minimum around implicit bias, and maybe sharing a little bit of what your concerns are or thoughts are, and like how to even start. Because I think that's probably where a lot of us are, is, you know, we know this is important, but it feels like, how do we even begin? And I would love to just hear kind of what those folks' thoughts are about what resources they might be looking for, and how they would want to integrate that, what tools they might need to integrate that into their curriculum.
This is Mickey Gilmore with Frontier Nursing University, and we're an online school with a large number of students, and we have students all over the country, preceptors all over the country, and even outside the country. And so far, I think we've really focused more on cultural humility as a concept than implicit bias. I participate in the women's health course, and we have a office visit in that course that we do online, where the faculty play the patient and students are the provider. And then they reflect on what happened. And one of the parts of the reflection is how their own cultural background might have influenced their care of this patient, or some issue that this patient brought to the situation. It's been fascinating to me to read these, because they often think they don't have a culture still, even though we've discussed it, I know, in earlier courses, and and they have, you know, read things, done in other reflection exercises, but jumping over that hurdle to recognize that, yeah, actually we all are biased no matter what we think, and, you know, it's kind of in the water we drink. It's a big, huge hurdle to get there, and it's for the faculty as well. I don't think it's just the students. It's all across our whole culture to recognize that, you know, there's a lot going on here.
Yeah.
For white people.
Yeah. And I think even in just the way that many of our current midwifery education programs are set up, they're located within universities, which have traditionally been a place of power, mostly for white students and faculty. It's not always been a place that's been accessible. There are certain hidden rules, and there's a culture within academia. There's a hierarchy. If you didn't grow up in a family that had a lot of people who went to college, you don't know that culture. You don't know those unspoken rules about the etiquette of how you reach out to people and what resources are available to you. And that image of, it's in the water, it's so true. It's really hard to make. I think you're speaking to that challenge of how do we make explicit what is implicit.
Right.
I just actually heard a great example on a video I was watching recently that's relevant to midwifery care, that a group of midwives at a hospital was noticing that a lot of their Vietnamese patients were experiencing dehydration during their labor. And they were trying to figure out why. Was there something physiologically different, or what was going on? And when they delved down into it, they realized that, we're coming from, we, meaning the medical world, generally come from this perspective that hydration and water is really important in labor. And it helps to, just helps overall with physiologic health. Whereas in Vietnamese culture, there's a concept of hot and cold, and in labor, you don't imbibe anything cold, and water, even without ice, is considered cold. So they're going to withhold that. So just little things that we might, throughout the day be recommending as basic things for diet or exercise or hydration, that we just consider normal. This is good for your health. Well, you know, who even defines health? I think stepping back and even having those kind of conversations, helping students learn how to connect with patients and learn more about their patients' understanding of health and wellness versus illness, I think is really important. And Mickey, you're right. I think this is a really big struggle. It's hard to just feel like you can be successful in it within a short program, especially, you know, most midwifery programs are only 2 or 3 years. And then how to support faculty in that. And I would actually love to talk more about that, because I feel like that's a question that I hear a lot is, you know, as a faculty member, I don't know, I don't know much about this. I don't feel comfortable yet teaching this. I'm not an expert in this.
And even when people do implicit bias tests, like somebody earlier in the conversation said, you know, they go, this has to be wrong. You know, they can't even say, step back and go, whoa.
Right.
And I am frustrated. I don't know how to move people beyond that.
Well, I don't think that we can, right? And I think it's going to be something they're going to have to deal with on their own, but we can offer many opportunities, as many as possible throughout the curriculum to bring this up. I think every clinical case study that's presented, doesn't matter.
Broken record.
Yes, right? Every clinical case study, whether it's in your basic gyne class or your IUD insertion training or your antepartum exams or the intrapartum intake, should have a built-in opportunity to reflect on what implicit biases. And it's not that you might necessarily call that out as, okay, now we're going to look at the implicit biases, but really do try and integrate opportunities to discuss the holistic picture, not just the clinical piece of it.
I wanted to just mention, somebody already mentioned Wendy Gordon's class at Bastyr, and at Birthwise, we all as a staff and many of the faculty did a 3-month kind of online class with Wendy. We took her Power and Privilege in Midwifery course as a group, and it was really powerful for the school to do that together and kind of know that we have all learned these same kind of basic things to build on. It's a great foundation. I highly recommend it.
Thank you for that. Yeah, I agree. I think there's something really powerful in just your own individual experiences of that, of doing it as a community. And then I think that really speaks volumes to students as well, to know that their entire faculty have viewed this as a commitment, that they recognize that this is a really important part of supporting students to be, you know, mindful, thoughtful, well-rounded clinicians. And it says that this is a safe place to continue having those conversations, even when it brings up uncomfortable feelings or emotions. And that's where I really go back to that concept of faculty as models. You know, when we send students out for precepting, you know, to their preceptors, part of that is not just that they're learning how to do things, but they're seeing clinicians in action. They're learning different ways of speaking and being and moving as a midwife. And I think this is a piece that we need to make transparent, or a little more transparent as well, that we can show students the process, that this isn't just you take one class and then you're good, that it is ongoing.
I would add, this is Kristen, that I'm just really honest with my students that I have tried, you know, every time I revise my syllabus, I spend time, you know, and I just say, and I'm still learning, and I welcome, you know, you to confront me, or, you know, talk with me or give me ideas for the next round. And I encourage them to speak up in class as well. I stick around after class, and I certainly don't have it dialed by any means, but I am continually surprised I've taught the Midwifery Care 1 is our first introduction to midwifery care course since 2013, and I can spend hours every syllabus revision thinking more about what more can I do, how can I do this, and yeah, just that never-ending process, like you talked about, that constantly working on it. Yeah.
Yeah. Thank you. Are there any other questions that have come in through the chat?
Not yet. Some people have had to leave. I'm just checking though. There might be one here due to having to teach class, ironically.
Of course.
Of course, exactly. But a lot of comments, a lot of thank yous so far in this regards. And Marcy at NCM was sharing that they had also developed an implicit bias training for their students and preceptors, and gave her contact information if anyone's interested in the chat box.
Oh, good. Yeah, I am definitely interested in connecting with folks around a preceptor training. I think that would be really great.
That reminds me of another question that always comes up, so I just posed it for any new folks who are here. Any ideas as well for sort of how to get preceptors to do it? If any, unfortunately, Marcy has already stepped off. It sounds like they've just made it a requirement for their preceptors. So that's what they did. And I'm not sure how many hours it is, but our course being like 25 or 30 hours, we haven't yet required it of preceptors. I don't think, I think we keep talking about whether we will, but they're strongly encouraged to do it at this point.
This is Robin again. We haven't done this yet again, but one of my ideas was we pay a small stipend to our preceptors that we haven't increased in a while. And my thought was kind of having like a tiered payment. You know, if you've done this training, then your preceptor stipend goes up a little bit. Just trying to have some kind of incentive, either that or just offering CEUs along with it.
Oh, I think CEUs would be great. Everyone always needs those.
Great ideas. I'm so glad I brought it up again. It comes up every call. And so look, we're coming up with solutions as we go. Perfect. We've got someone here in the chat. Erin, you're welcome to unmute yourself, but perhaps you'd rather us read it. Yeah. Oh, she's got to be, okay. So yes, she had to go into a public place. Okay. One of the challenges she's faced, she thinks the biggest challenge she's facing in the world is that white people feel that they did the work and are done or have arrived to the wokeness. I love that you started by explaining how human the bias is and how it's always there.
Yes. Yeah, I mean, there's definitely a lot more conversation about race and issues of equity, et cetera, these days, which I think is awesome. But I think it's hard. I don't think I've come up with a good fix for this yet. This concept of like, okay, now I'm overwhelmed and I'm going to like take a break from that because it's just too much and I'm going to just focus on other things. You know, that's kind of a luxury that white folks have. They can kind of choose if and when they want to be more active in that self-awareness, and it doesn't really impact them as much as it might impact other people. I think having a community of like-minded folks who are journeying with you is important. And, you know, I'd really love to see continued connection among this group for folks to share ideas as they continue growing their programs, expanding their curriculum, making revisions, like I said, so we don't have to keep reinventing that wheel.
Yeah. Yeah. Thanks for sharing that, Lena. And I won't do it right now because I want to allow space for other things. But if folks are interested in hearing the ways in which I think some of my own implicit bias may have impacted my decision to not reschedule the call today on Yom Kippur, I'm happy to share that. But I do want to, so you can let us know if you're interested, but there is some other things in the chat box.
Okay.
Misty is saying, we are a small practice and have no issue with our preceptors taking these trainings over and over. However, one of our problems is protecting students from our clients. We have not seen any overt racism per se, but extreme homophobia. And she knows that's not the topic at hand, but well, I think it is actually. Yeah. So, and she said, are there any trainings for this? And Misty, I'm not sure exactly what you're thinking about trainings for, but protecting your students, it sounds like.
Yeah, I would imagine that there are a lot of great resources around LGBTQ issues for clinicians and preceptors, but in terms of patients, that gets a little trickier. Just sort of thinking off the cuff, I think it's really the preceptor's responsibility to set the tone for what is respectful, and this the care that a patient receives, that is a reciprocal relationship, and setting a culture within the practice that it's not acceptable to be demeaning in any way to students. And I think what's hard about this is that it's not always overt. It's not always even intentional. A lot of we call those microaggressions, things that seem small that people don't really think about, those little slips of tongue or lack of speaking up, but that can be really hurtful for students of color. Can be hard. But, one thing that, just if I were in that situation off the top of my head, I would think about creating some kind of diversity statement for the practice that's displayed quite prominently. I would be sure to, prepare patients for the fact that they're going to be students, regardless of whether they're students of color, but, having their photos and their bios and really getting a chance to introduce that student as a whole person. And then when the midwife is, offering the opportunity for that patient to work with the preceptor to speak up that student. I think this goes even for everyone, not just students of color or for LGBTQ students. I think it's often just an issue with students in general, but in particular for those groups, I think it's even more important to, highlight the qualifications and all of that kind of thing, but really setting a practice culture that, diversity is welcomed and that we care for everybody and that we love training midwives and expanding the midwifery practice and workforce. So those are just some immediate thoughts.
Thanks for that, Lena. If anybody else wants to jump in, please do. And while you're thinking about that, we just wanted to lift up a couple of comments here in the chat box. One is from Robin, who recommended the book White Fragility by Dr. Robin DiAngelo. She says, the book White Fragility is a great resource for white people on all of this, getting rid of the binary that if you have any racism in you, you are, quote, bad, so you cannot admit to any of it and thus can't change or dig deeper. And Mickey seconded that recommendation and also added a kid's book that's helpful for white people specifically called Not My Idea, a book about whiteness. So just a couple more resources to add to the conversation from Mickey and Robin.
Awesome. Yeah, I have been really enjoying the White Fragility book. I have it on my bookshelf. I can see it right now as I speak. And I think it's a really great resource. And, I'm reading it. I'll just speak a little to my personal experience. Most people would not identify me as white. I look very Korean because I am a Korean adoptee and I grew up in a white family. So I feel like in many ways, culturally, I am white. And it has been sometimes very confusing for me as a Korean adoptee to navigate these two different identities, sometimes overlapping and sometimes not. I am on the receiving end of many privileges, privileges of education and able body and, sort of being in a group considered a model minority. But yet I'm not seen as white by other white people. So I think it's been an interesting read to look at that concept of white fragility and apply it in a slightly different context. So great read. And it's pretty approachable too. It's not a big, long, in-depth text. All right. Any other comments or thoughts before we kind of wrap things up? Crickets. All right.
I wanted to leave a space for people to say something if they wanted to. I posted an example of a clinic diversity statement that I just found quickly. And I can't promise that it's perfect, but it's an example of one.
Yeah, awesome.
Yeah. And then I did think I would share, because of my choice to schedule and to allow the scheduling to continue for today, I thought I would approach it because I just thought I'd share the story because I think it's something we could all come up against. Certainly as I said, as educators, we schedule things. And I initially scheduled this call with only 1 or 2 other people. At that time, I didn't realize that I was scheduling on Yom Kippur. Something I could have done differently, a pause point I could have introduced at that time was to double check a diversity calendar to see what things are going on in September for cultures that are not my own, that I'm not familiar enough with to just know offhand. And so, when scheduling, I could have looked to see on this particular calendar, I'll share, Courtney will post the link, Diversity Best Practices. It actually says Yom Kippur, the holiest day on the Jewish calendar, which would have been a great pause point. In fact, I know that I wouldn't have scheduled if I had taken that particular pause point at that time. But I did. So moving forward, at some point I put this on my own calendar, and I did see some blue letters on my calendar that said Yom Kippur. I knew that meant that it was a Jewish holiday. And I chose to not pay any more attention to it than noticing at that time. Things I could have done differently. I could have taken a pause point to have researched and realized that it was the holiest day in the Jewish calendar. I also could have called a friend and talked about this. I already scheduled this. At least some people have it on their calendars. What do you think about this? A Jewish friend of mine and colleague would have said, please reschedule. And I didn't do that. So I sent another notice out 11 days before today. I got an email from a dear colleague, saying, hey, this is a Jewish holiday. Once again, I could have called her to talk more about it. I could have researched and found out that it was a very important Jewish holiday. And at that point, if I could go back in time, I would have rescheduled. At that point, I sent her an email that didn't make her feel good. It didn't make her feel bad, but she just sort of thought, we can do better than this. And I agree with her. And it wasn't, I didn't really start paying attention, even though I should have, even though I know better, even though I want to do better. Until yet another friend contacted me and said that 3 people contacted her to let her know about this scheduling conflict. And so at that point is when I finally decided to repair with my friend who had emailed me and who I didn't pay enough attention to in the moment because I was busy and just didn't, and unfortunately didn't. And then I realized I needed to apologize publicly. And it's finally in this moment where I began to think about my own implicit bias and how it probably impacted me. I was raised Catholic and went to Catholic school for 13 years, and I have learned things about Jewish people that I wouldn't want people to know, you know, about me. I've been told things, and I'd like to think that that's not me, but I can't promise that it didn't play a role in my not dealing with this sooner, not paying attention sooner when I could have. And there are structural factors as well, right? Our entire calendar in this country is shaped not around the Jewish calendar. So that's just my story that I thought I would share with everyone.
Thank you so much for sharing, Kristen. That was such a great example. And yeah, I just really appreciate you being open about it.
Yeah, thanks. Thank you. And just bringing back up that concept you brought up of that constant practice of self-assessment. I do know better, and somehow, you know, I just didn't do better this time.
Yep. And there will be many more opportunities to continue learning that lesson.
And so, yeah, with that, unless there's anything anyone wants to kind of just insert here, Lena, I don't know if there's anything else for you, but I'll go ahead and do our final wrap-up announcements unless there's anything else.
No, I think that's great. Go ahead.
All right. So as we are wrapping up, I have a few announcements. We would like to know your book choice for our first ever Midwifery Educator Book Club this January. So we really hope you will please fill out our very brief survey. I'm going to share my screen here so that you can see how brief it is. I think I hit the wrong button there. Try that again. Share. And I'll let you see the choices that I've come up with. And you can also insert a different choice, which if you get it to me soon enough, I could add for other people to vote on as well. So these are the 3 books that I came up with, and I did ask a few other people what they thought about it and didn't get any other choices at this point. So the 3 choices are Bandwidth Recovery, helping students reclaim cognitive resources lost to poverty, racism, and social marginalization. The second choice is Whistling Vivaldi, How Stereotypes Affect Us and What We Can Do, Issues of Our Time. And the third choice is Culturally Responsive Teaching and the Brain, Promoting Authentic Engagement and Rigor Among Culturally and Linguistically Diverse Students. So I hope that you will rank our books so that we can choose one and go forth with our book club. The date for that is going to be that January 23rd. I'll show you here at this same time of day. And I did check the diversity calendar this time, but if there are major conflicts, someone should please let me know. And we will record. The intention will be to record as well. And all of the following information that I'm about to share can be accessed on the website, equitymidwifery.org, at any time. The webinars, as I mentioned briefly, and we hope you will attend our upcoming webinars on Wednesday, October 24th at the same time of day. Rhonda Lee Grantham from the Center for Indigenous Midwifery will present a webinar about supporting aspiring midwives. And she told me, but we haven't officially decided on a title yet, that she's going to talk also about some Indigenous ways of knowing. On Thursday, December 13th, same time of day, Cynthia Ballou and Byronia Matthews will be presenting on stereotype threat. So that will be, you know, if we end up choosing the Whistling Vivaldi book, you know, we could dig deeper on that topic after the webinar, which will happen in December. And I just want to say thank you again, Courtney, for your behind the scenes work to help this call run smoothly. I couldn't do it without you. I'm so grateful for you on so many levels. Here's that diversity calendar I referred to. And Courtney will post the link for that as well in the chat box. Thank you again, Lena. Really, you are awesome. I'm so grateful for your time.
You are so welcome. It was my pleasure.
And your insights, yeah. And finally, thank you all so much for participating. We hope you'll make it again in the future.
Thanks so much, Kristen and Lena. This is Courtney. I really appreciate both of you here today. And I do want to just highlight as we end one comment from Stephanie Siebert, who gave permission for the comment to be shared publicly. It's in the chat box, but I also want to lift it up aloud. In regards to just some closing words and cautionary, I think, comments regarding how we move forward with implicit bias. So Stephanie wrote, I'd like to point out that our personal walks with implicit bias are not necessarily meant to be a public journey. When we make a mistake, we absolutely must make sure that we are not turning our apologies into an episode of white centering, which of course connects with some of our earlier conversations. So I really wanted to lift that up and circle back to that. So I think that's a really important reminder, and I just really want to thank Stephanie for that piece.
Yes, absolutely agree.
As do I. I think I'm still unmuted. I was trying to figure it out. I don't know if Courtney or if the person who commented, if there is anything more to say, but I know these words I've heard, before, but and maybe it's just a call, a topic for a future call. I always get ideas at the end, right?
Yes.
But I don't know if there's anything more to say, because that statement is important and so packed. So I just want to put that out there.
Absolutely. Stephanie, you're welcome to unmute if you have anything else to say, but I will just echo this piece that I think that there's a very fine balance, right, between being able to apologize for our mistakes and commit to doing better versus allowing it to go to such a level that we end up recentering self and especially whiteness for those of us that are white. So I think there's a lot of nuances to that, and I think continued conversations in this regards is important while we really heed the cautionary comments and comments here that we're lifting up at the end around implicit bias and how it can inadvertently center self again. So.
Thanks, Courtney. It's good to just hear it again so we can just think more about it. I appreciate it. Okay. I think that the idea of centering is a good one to think about. So I think with that, I would like to think about centering our colleagues, our friends, those who we know and who we don't, who are celebrating, well, and I don't know that celebrating is the right word, but who are taking time out of their busy lives today for a very important holiday in their faith. And so thinking of them and the voices that we missed today at our proverbial table. And with that, I think we can go ahead and sign off. Thanks, everyone.
Thank you.
Thank you so much, Lena.
Thanks.